Okay, again, Mike Karegeannes here, TMJ, TMD specialist and physical therapist. I would like to explain to you what a disc displacement that does not reduce looks like inside of our temporomandibular joint. So if you've watched the normal mechanics, you have seen the disc displacement with reduction. Now what we frequently see and can tend to be more painful and certainly functionally disturbing, meaning yawning can be difficult at this point. Eating and biting into certain foods can be very painful as your opening can be limited. When we have a disc displacement that is not reducing, the disc has remained forward and the condylar head cannot get around it. And at some point, this condylar head butts up against the back posterior portion of the disc, and that limits your opening. So let's say if normal opening, we generally like to say is between 40 and 50 millimeters. Obviously, there's people with a little bit less, people with excessively more, but 40 to 50 intercisal measurement is pretty normal. Not uncommon for people with a disc displacement without reduction to be limited sometimes 30, 32, 35 millimeters of opening. It's one of the clinical telltale signs of a disc displacement that is not reducing. Also, it's not uncommon for these people to have a history that my joint used to pop and click, but I could open normally. All of a sudden I woke up this morning or I had a bagel for breakfast and all of a sudden the noise stopped, the popping and clicking stopped, but I was also limited now in opening. So when you have a disc displacement that is not reducing, the disc is not reducing, that is because that disc is sort of acting like a doorstop. It's blocking the ability for this bone, the condyle, to translate further forward so you can open normally. Now, there's all kinds of different schools of thought. Can you recapture this disc? Can you not? Do you need to have surgery? I mean, I can tell you in my 30 plus years of experience, it is very rare, in my humble opinion, you ever need to have surgery here. This can be managed very well with great conservative care, but the challenge remains. There are very few of us between the PT and the dental community that have the credentials and the educational skill set to actually help you manage this. So that is still a problem that we are all faced with throughout the U.S. and quite frankly, globally. But eventually, what I hope will happen in time with the appropriate course of treatment is that we will take this disc that is not reducing and we will get it to reduce again. So you will go back to this popping and clicking joint so that at least we know part of the time your disc is in the proper orientation. But the longer that you are in this anteriorly displaced, non-reducing position, really the less likely it is that that disc probably will ever somewhat reduce. I don't like to use the word recapture because in my opinion it's only recaptured for a brief moment. I don't want to give the perception that you are recapturing it permanently. But then what we believe happens, and of course we see this on MRI studies, is little by little, by increasing the extensibility of some of these structures that can become tight, the disc will continue to move further and further out of the way forward. So I'm going to this model won't completely let me move this any further, but imagine your disc will continue to migrate further forward and out of the way, and you will be able to then resume a fairly normal opening. So while you might still have a disc that's displaced and not reducing, most people will achieve very successful complete pain relief with excellent return of function and hopefully not have really any future problems with this particular joint because this joint is very resilient. And maybe at some point we'll talk about, why is the temporomandibular joint so much more resilient, let's say, than our knees and our hips? We rarely have to have joint replacements in the jaw, except for maybe major trauma. But obviously we know the knees and the hips and other parts of our body wear out much quicker. So thank you for the opportunity to share some of this information.